I need you to hear me when I say this. And I had to learn this the hard way when I was in bed strapped to chemo, going through a stage 2 blood cancer diagnosis. You are the only person who can save your body. You are the only person who knows your body the way you do. Doctors are not God. Research is not the gospel, and just because it has a study behind it does not mean it's for you. And just because it doesn't have a study behind it doesn't mean it can't work for you. The healthcare system in America, it's a business. This video is not just about the problems in the system. It's about how we blindly trap ourselves when we idolize them. And it's time to stop doing that. Let's start here. Hospitals used to be nonprofits, they used to be charities, but today they're multinational corporations. CEOs of hospitals are making millions and their board of directors are making billions. Insurance companies? Hey, the worst of them all. They literally profit from your sickness. And if you try to claim any of your money, which they probably have stashed in some private equity fund, retirement schema, who knows what, not only are they profiting off of your sickness, but whenever you try to make a claim, it's like pulling teeth, right? You get a hospital bill that's 13 pages long, and not even the smartest doctor at that hospital could tell you what half of those things on that bill is. One of my favorite books I read during my time in chemo that really contextualized the things that I was feeling and seeing was Elisabeth Rosenthal's American Sickness. In the book, she breaks down how financial priorities now steer decision-making across the entire medical field. That means every test, every prescription, every specialist referral is moving money. In the book, she names insurance companies methodical money takers. Insurance companies will tolerate outrageous fees from pharmaceutical companies just to pass the cost on to consumers as higher and higher premiums. And if you've gotten an insurance bill or you pay a monthly insurance premium that is so high that you're like, something has to be wrong, I want you to know that it's working exactly how they plan it to. The system is a business. From the nurses, the doctors, the hospital beds, the hospital themselves, to the insurance companies, to the pharmaceutical companies, it is all one business. And that is why it's so important not to idolize it. Because I need you to understand that decision-making in this entire industry has now been correlated to how much money can someone make. And that can be very dangerous when we're talking about the well-being and health of society. Let me talk to my people who live and die by studies show. Oh, is there a study behind that? I haven't heard of studying that. Oh, there's no studies to prove that. Here's the truth. Although I love some of y'all's eagerness for science, just publishing a study takes anywhere from $5,000 to $20,000 just for it to be published. We're not talking about what it takes to get scientists, resources such as labs, chemicals, wherever you need, patients or clients, and to actually run the research. Just publishing alone, once the paper is written, once the research is done, is $5,000 to $20,000. So let's not even mention the cost of actually funding an entire study. We're literally talking anywhere from 20 to hundreds of thousands of dollars. And guess who's paying for it? It's not Mother Teresa, it's large corporations who cease to benefit from whatever studies are published. So I studied quantitative economics in undergrad. One of the first things you learn in econ is supply and demand theory, right? Supply and demand determine price at equilibrium, and there's different things that can shift the supply and demand axes. And one of those things is taste. What consumers want. What do they think is best for them? What do they have a taste for? What do they want to buy? Taste can shift demand significantly. And literally, the example in my applied economics book was, if there was a study that came out tomorrow that said, if you ate bread every single day, you'd live past 100 years, Whole Foods, Trader Joe's, Target, it don't matter who, bread would be off the shelves. Hundreds of thousands of people would run to the store buying bread every day because they heard that it makes them live long and they believe it, right? That's how studies move the market. That's how money manipulates beliefs. I'm not saying don't trust anything. We should trust doctors, just not blindly. We should trust some studies, just not blindly. And most importantly, do not discount the basics. Do not let a study change your mind about something you have personally experienced or your community has personally experienced. People's and communities' experiences, their healing journeys, their medicinal ways are data points as well. Generational wisdom is a data point as well. Just because it isn't peer reviewed doesn't mean it's not true. When you really deep this, you realize that the scientific process is not just limited to labs and white coats at certain institutions. At its core, the scientific process is literally questioning, testing, sharing observations and results. And that's exactly what our ancestors did. That's exactly what our communities do. They experiment with herbs, with food, with rituals, with movement, and they pass along generations the results of those things. And I hate the current climate of people who never want to question experts or the current medical scene. Like, that got us in a lot of trouble during the COVID vaccine period. It's important for us to allow each other to question one another. Talking about leave it to the experts, leave it to the scientists. Yes, I respect the expert that has studied this, and I am more prone to believe them and more likely to hear them out and hear their argument. However, when you blindly follow somebody because they have a degree, what you're allowing in that moment is the death of science. It's literally scientific to question science. How do you think new discoveries are made? How do you think some theories are unproven and disproven? You have to continuously question. And this is extremely important when the people producing the medication, the cures, the studies don't look like you, don't live like you, and don't have your body type. Especially when their patients that they do these clinical trials on and their control groups look nothing like you. So they've actually not tested somebody with your blood makeup or your body makeup or the makeup of your skin, etc. It is not anti-science, unprogressive to push back. That is the most scientific thing you can do. That is the most brave thing you can do. That is the best thing you can do to take care of yourself and the people that you love. We've placed so much trust in the scientific methodology and the people in the lab coats and studies that we forget that this system is human built. It's a human system built by people who have different incentives across the board, built by people who can also make mistakes. Your lived experience is just as much science as anything done in a lab. Trust your intuition, listen to your body, and respect your lineage of knowledge. All right, now that we've cleared the mindset shift that we really need to have if we're going to have an honest conversation about the American healthcare system, let's talk about Elisabeth's book, American Sickness. In American Sickness, Elisabeth breaks down the economic rules of the dysfunctional medical market. And I'm going to read a couple of them to you. 1, more treatment is always better, and you must default to the most expensive option. 2, a lifetime of treatment is preferable to a cure. 3, amenities and marketing matter more than good care. 4, as technology age, prices can rise rather than fall. 5, there is no free choice. Patients are stuck, and they're stuck buying American. 6, more competitors vying for business doesn't mean better prices. It can drive prices up, not down. 7, economies of scale doesn't always translate to lower prices. With their market power, big providers can simply demand more. Don't we see that? 8, there is no such thing as a fixed price for a procedure or test, and the uninsured pay the highest prices of them all. 9, there are no standards for billing or billing processes. There's money to be made in billing for anything and everything. And 10, the scariest of them all, the prices will continue to rise to whatever the market can bear. Let's talk about what this actually looks like in real life. For example, you ever go to 5 doctors for one problem? Not only is it expensive, it's inefficient, and you usually never get to the root of the problem, but it's normal. That is the American way. Healthcare system is fragmented in different pieces by design, on purpose, to extract from you the most money as possible, refer you to a bunch of different doctors who will give you a bunch of different prescriptions that will never cure the root of your problem. One specialist for this, another one for that, all of them billing you separately, none of them talking to each other. And your health is what's held at limbo. Mind you, you're already overworked and resources are scarce. You don't got time to be wasting. I learned that this fractionalization is on purpose through Casey Means, who's a Stanford educated, top of her class physician who left behind the traditional medical world because she was like, this system is so broken and is literally victimizing millions of Americans. Casey talks about how at the best medical school in America, Stanford, doctors are literally trained to think about very specific parts of the body as separate entities rather than being trained to understand the body as a whole. She talks about how we've brainwashed society and doctors to think that specialization is king. We as a society and the medical system and the way that doctors are rewarded and institutions reward smart individuals to basically diminish the value of things like primary care or pediatrics, which are the doctors who are the cornerstones of our medical system. Instead, society, the healthcare sector, and institutions reward individuals for being ultra specialized. They get paid the most and they get the most prestigious opportunity. She talks about how the dean of Stanford currently is someone who is specialized in literally 2 inches of like the neck and the ear. And because they know that area so well, they hold this really prestigious title as this dean of Stanford's medical school. However, is this individual who's being highly rewarded with probably a really high pay and prestigious title the person you want to talk to if you have an ear problem that's connected to your hip problem or the fact that your liver is doing something weird? Probably not, because they have been taught to ultra specialize. They don't understand how the body works as a whole. And if you had a problem in your liver, they'd probably send you to a couple other specialists that they would never talk to. And that is the American system. And this is not only the doctors or the individual's fault, right? Doctors are literally drowning. They are overbooked, under-resourced, seeing 20 to 30 patients a day just to keep their hospital happy, just to keep billing hours to insurance companies. Even if the individual cares, the system makes it impossible for them to care well. And they have to pay because they themselves are drowning in hundreds of thousands, if not millions of dollars in debt from all these medical institutions. And let's not forget the middlemen, the coding specialists, the billing specialists, the insurance reps, the sales rep from these pharmaceutical companies, the lobbyists in DC changing pharmaceutical and medical laws. They're all making money, all of the bureaucratic administration bloat. There are layers and layers of profit sitting between you and actual care. But again, this is all on purpose. Dysfunction is profitable. Dysfunction creates room for corruption. And all the confusion that all these different layers bring keeps people from being able to pin the actual problem. Let's talk about drug prices. Y'all ever wonder why that medicine that costs $1 to make end up $500 at the pharmacy? It's a life-saving medicine, so they know if people do not have it, they will die. So Rosenthal does a really good job laying this out. What the map really looks like starts at pharmaceutical companies who develop these drugs, right? So pharmaceutical companies manipulate the FDA system. They stack patents, they file lawsuits against generics, and they pay competitors to delay cheaper alternatives. It's literally called pay to delay. Not to mention, they are incentivized to charge really high prices because their insurance companies would just pass it on to the consumer in the form of premiums. And that really high price, that spread, that profit between what they make it for and what they charge their insurance company for it is their profit for their millionaire and billionaire CEOs and board members. I say all this to say I am not anti-big pharma, maybe a little bit. I'm not 100% anti the American medical system. I'm not anti-science. I'm not anti-doctor, but I want everyone to really have a peek into the problems that exist within America's health infrastructure. We can never have honest conversations about them if we continue to idolize Western medicine and to act like everything is all right, although it's really just a profit system. One thing that I am anti is anti-stupidity, anti-ignorance, anti-delusion. The delusion that what's in a white coat and comes out of a clinical trial would save us is one we can't afford. Like, it's literally killing us. And I didn't really understand this until it was me. I used to think my mom was so crazy, not trusting doctors and just like anti-science and all her woo-hoo herbs and this and that. But when I was diagnosed and I was sitting with doctors that couldn't give me any answers, and I came to the realization that my health is my responsibility and thus I have to explore all avenues, and healing is a myriad of things across the whole body that most doctors today do not understand. That's when I was like, ooh, I have to wake up. And so I just want to wake you up too, right? Like when I was fighting cancer, yes, I had chemo, but I also juiced. I also fasted and prayed. A lot. I ate clean, I took supplements, I stopped working and just rested, which is an immense privilege, but really helped me heal. I did a bunch of things that has no studies to prove them at all, but they all helped significantly. I had an incredible chemo journey. I kept my hair. It was a literal miracle. Listen, the American health system is not failing us. It is doing exactly what it was built to do: make profit off of your pain and to keep you in dysfunction so you will not ask any questions. And that's why it's sadly on you to get informed, stay smart, and keep asking questions. What is in this medication? Who funded that research? Who funded that clinical study? Is there a natural path that may help your body? Is there something I could change in my daily habits that could make me better? Or is there something in my daily habits that is making me sick? Although it is unfair for the individual to be burdened with something when we pay such a high tax to have a public health system, at the end of the day, your health is worth way more than anything else on this earth. And I would do anything in this world to keep myself healthy. What is that saying? You have 100 problems until your health is one, and then you only have one problem. And that is 100% true. As someone who knows Christ, healing is your birthright. Don't ever hand that power away. Because at the end of the day, no one cares about your body and no one cares about your health the way you do. And do not let America's medical system act like they care. Some people do, but the system overall is built to not care. So I need you to take agency over your life and over your health. It is in your hands. And as always, like, comment, and subscribe. I'll see y'all later.